Why does radiation cystitis cause blood in urine, hematuria? Imagine your bladder as a stretchy, protective bag that holds urine, lined with delicate cells. When radiation therapy is used to treat cancers in the pelvis, like prostate or bladder cancer, it can unintentionally affect this lining. Radiation causes damage at a cellular level, which can lead to bleeding in the urine, known as hematuria. But how exactly does this happen? Radiation therapy works by delivering high-energy beams to kill cancer cells. It damages their DNA directly, causing cell death. It also creates free radicals, unstable molecules that damage nearby cells by breaking down water molecules into reactive oxygen species. These radicals harm cell membranes and DNA, especially in tissues with low cell turnover, like the bladder lining. The bladder's inner lining, called the urothelium, is particularly vulnerable because it renews itself slowly, making it more susceptible to radiation injury. There are two phases of radiation cystitis. The first is the acute phase, which occurs during or shortly after treatment. During this time, the damaged bladder lining becomes inflamed and irritated, leading to symptoms like blood in the urine, pain, and frequent urination. Usually, these symptoms resolve within a few months once the radiation stops. The second is the chronic phase, which can develop months or even years after treatment. Chronic radiation cystitis involves damage to the small blood vessels that supply the bladder. Radiation causes a condition called obliterative endarteritis, where these tiny arteries become narrowed or blocked. This reduces blood flow, leading to tissue oxygen deprivation or hypoxia. To compensate, the body tries to grow new blood vessels through a process called neovascularization. However, these new vessels are often abnormal, fragile, and prone to rupture. When they break, bleeding occurs, resulting in blood in the urine. Over time, radiation also causes fibrosis, which is the formation of scar tissue in the bladder wall. This scar tissue replaces healthy tissue and further impairs blood flow. The combination of poor blood supply, tissue scarring, and fragile new vessels makes the bladder lining very prone to bleeding. As the tissue deteriorates, it can become atrophic or even necrotic, meaning parts of the bladder tissue die off, which can worsen bleeding. The timeline for hematuria varies. Some patients may notice blood in their urine during or shortly after radiation therapy, while others might develop symptoms years later. Studies show that about 2 to 8% of patients who undergo pelvic radiation develop radiation cystitis with hematuria. In severe cases, bleeding can be intense enough to cause blood clots to block the bladder outlet, leading to urinary retention and significant discomfort. It's important to recognize that blood in the urine after radiation therapy is a sign of tissue damage and vascular changes in the bladder. If you or someone you know has a history of pelvic radiation and notices blood in the urine, it is essential to consult a healthcare professional. They can evaluate the cause, monitor the condition, and suggest appropriate management options. Understanding this process helps in managing symptoms effectively and maintaining bladder health over the long term. Always seek personalized medical advice, as individual experiences can vary widely.